GooZam, a difference in first response. Did you know more than 326,000 people fall victim to cardiac arrest outside of a hospital each year, and about 90% of them die? This is because at least 5 out of 10 individuals are not trained and certified in performing cardiopulmonary resuscitation, also known as CPR. Hands-only CPR is an emergency procedure that can double or triple an adult patient's chance of survival. Unless you act quickly, a victim with no oxygen flowing in their bloodstream can suffer permanent brain damage after 4 minutes and die after 8 to 10. Anyone can and should learn how to perform CPR, and here's how to do it. Before you start, check for responsiveness. Tap on the victim and shout, "Are you okay?" If no response, check for a pulse by placing your index and third finger on the victim's neck to the side of the windpipe. If there are other people in the area, call for help, dial 911, or press the appropriate GooZam app button. For adults and children 9 years or older, perform hands-only CPR with the following steps. Number 1. Lay the patient on their back and kneel next to their neck and shoulders. Number 2. Place the heel of one hand in the center of the victim's chest and the other hand over the first, lacing your fingers together. Be sure to keep your elbows straight and align your shoulders over their hands. Number 3. Begin 30 chest compressions using your upper body strength for at least 100 beats per minute, allowing the chest to rise fully between compressions. In most surroundings, an AED defibrillator may be present and can be accessible in case CPR is not successful. Simply remove the AED from its station and follow the instructions inside. For children and infants under the age of 9, follow these steps. Number 1. Tilt the head back and lift the chin to open the airway, checking for breathing. If the child is not breathing, give 2 rescue breaths by pinching the nose and sealing the mouth. For infants, seal over both the nose and mouth. Number 2. Blow in for 1 second so the chest visibly rises. Repeat once and give 30 chest compressions, pressing about 2 inches deep with one or both hands. For an infant, push with 2 to 3 fingers about 1.5 inches deep. Rescue breathing and chest compressions are often practiced for this age group due to blocked airways leading to cardiac arrest. Whether the victim is an adult, child, or infant, do not stop performing CPR unless an EMS or other certified person takes over, an AED is ready to use, the scene becomes unsafe, the victim begins to breathe, or if you are unable to continue. Following these steps will allow you to become fully certified to practice and perform CPR so that you will be ready to potentially save someone's life in the future. If you have an interest in geo-volunteering, join the GooZam organization and see what you can do to help save a life. If you have successfully viewed and learned from this video, please take note of this code as your training number, CPR 06202016. GooZam, a difference in first response.